Next, we will hear from Dr. Lindsey Butler, an environmental epidemiologist, science communicator, and thought leader specializing in the intersection of climate change and human health. She serves as the Director of Climate and Health Resilience at Blue Cross Blue Shield of Massachusetts, and we're so pleased she's with us today. Lindsey?
Thank you so much, Catherine. Thanks to NIHCM for having us today, and thanks so much to Dr. Balbus and Heather for what they've shared. I'm going to talk a little bit about how we are trying to address some of the challenges and opportunities that have been shared so far, and really look beyond corporate sustainability at how we as a health insurer are combating climate change and trying to advance health equity. Next slide, please. So we are really trying to take an integrated approach. We've heard about how the Biden administration is taking an all-of-government approach. At Blue Cross, we really want to take an all-of-organization approach to our environmental stewardship. So really trying to prevent sustainability from being sort of a siloed thing that exists in one part of our company, but really integrating environmental sustainability and climate and health resilience to the ethos of our organization across everything we do. And we see that as sort of having three elements. You know, this is an evolving strategy as we try to stand up to the climate and health crises that we're seeing. But right now, we sort of see three key components to the work. One is our own responsibility, recognizing that this isn't about personal and individual blame and shame, like many fossil fuel contributors have tried to get us to believe, but it's really about organizational and institutional change to address the climate crisis. So first, recognizing our own environmental footprint, our own environmental responsibility, and having our own ducks in a row. And like Dr. Balbus said, walking the walk. The second is the work that we do to advance environmental justice and our health equity work through our corporate citizenship team. And the third is our role as a trusted communicator. Heather talked about the importance of moving a community at the speed of trust, and we recognize that the Cross and Shield Blue Cross as an organization is a trusted communicator of health information. So we want to step up and we want to share information about the intersection of climate and health and how addressing the climate crisis is going to lead to healthier environments and healthier individuals. Next slide, please. Next slide. So just to highlight our work in our corporate sustainability and really sort of getting our own ducks in a row, on the one side, you'll see that we have made significant progress in reducing our environmental footprint at Blue Cross. Since 2010, we've reduced our electricity usage by almost 60%. We've made significant waste reductions. We're very intentional about the packaging and products that we allow into our buildings. We've reduced our use of paper. We've really become paper-free across the majority of our organization. So we've made progress. We have a robust corporate sustainability program, but now we need to take that further. We're working on improving our greenhouse gas accounting practices to better account for our Scope 3 emissions, which, as we know, are difficult to account for, but could represent a large piece of our emissions, especially with many of our employees working at home. How does that impact our environmental footprint as an organization? We're working towards carbon neutrality and zero waste. We are also trying to develop a best-in-class environmental responsible procurement program. We've been a leader in supplier diversity for a long time, and we want to get our environmental sourcing up to that same standard. So, you know, when we think about individual consumer power, right, we've seen that individual consumer power is key to advancing environmental actions, like we saw with BPA when it sort of came out of market based on the call of the consumer. Organizations also have a lot of power with how they use their dollars and their spending. So when we procure goods, when we procure services, when we enter into business partnerships, Blue Cross expects those partners to be doing the best that they can for the environment as well. And we want to use that power, that spending power, to really catalyze change. The last part of this is helping our associates and employees bring sustainability home. We're all adapting to this new remote work environment, and many people will stay working from home. So how do we take the practices we've developed for inside our buildings and bring those home to our employees at home, so they're working in healthier environments, that they're composting at home, and we're incentivizing them and educating them to do so. Next slide, please. We've also expanded our sustainable development goals. So previously we've reported on zero hunger, good health and well-being, and responsible consumption and production. Next slide, please. Moving forward, we are going to go after 3 more sustainable development goals, including sustainable cities and communities, climate action, and reducing inequalities. So we are expanding our reporting and expanding the way we approach our UN Sustainable Development Goals. Next slide. The next thing I want to talk about is the work we're doing to advance environmental justice, which is a pillar of our health justice strategy, which is our approach to corporate citizenship at Blue Cross. Next slide. Sorry, trying to whiz through so that we have time for conversation. This slide just highlights what our corporate citizenship strategy is and the work that we are doing in communities in Massachusetts to help people lead a healthier life with more equitable access to environments, experiences, and education needed for good health. We see that as that work sort of falls into 3 categories for us. That's our work to advance food justice, environmental justice, and racial justice. And EJ is obviously a really important part of the work that we're doing for climate and health equity. Next slide. Here I just highlight 2 of the partners that we work with to advance our EJ work. You know, really when you do this work, it's so important to really let the community lead the way. They know what the burden of pollution is, and they know the work that needs to be done. So we partner with 2 organizations. These are just 2 examples, Green Roots and Eastie Farms, who both do terrific work in the Chelsea and East Boston area of Massachusetts, which has a really, really difficult burden of air pollution, noise pollution. There are some manufacturing operations along the Chelsea River, and we support these organizations with our grant making, through financial support, through in-kind support, and through providing volunteers through our employee volunteering programs. Next slide. Next, I want to talk about sort of that trusted communicator component of this work. So step 3 in our work to advance climate and health resilience is to communicate, to educate, and to empower. And I just want to recognize here that I think what has been one critical flaw of the environmental movement or environmental support for climate action, whatever you want to sort of talk about our need to galvanize around this work, is I think oftentimes environmentalists, public health officials, we assume that those members of the community that we want to work with, we want to get folks to change their behaviors, to prioritize these things, we assume that they understand. And so what we're doing is we're asking people to change without really telling them the why exactly. So we really see communicating, educating, and empowering people about the intersection of climate and health to be a really key part of this work that we can contribute to. Next slide. So I just want to highlight that there's a huge appetite, according to the Yale program on climate change communication, when asked if folks are interested in more information about climate change and wanting to see more reports in the news on climate change, a nationally representative sample from the US, 74% of people said they were interested in hearing more. Next slide. And up to 78% of people said they wanted to hear more about the impacts of global warming in their local community. And as Dr. Balbus said, many of the health impacts of climate change are highly localized. So it's interesting to know that 78% of people want to know more about that. Next slide. Here's an example of some of the ways that climate is impacting health that we think that our members, our providers, our associates should know about and maybe haven't had the opportunity to be exposed to this information. So for example, recent research on the health impacts of heat stress on children have found that in extreme heat, there's an increase in ear infections, in ER utilization for heat-related illnesses, in gastroenteritis and other adverse outcomes in children. We know there's a robust literature that heat stress is leading to higher rates of preterm birth, low birth weight and stillbirth in the United States. And we know that there's many ways that climate change impacts air quality. And this just might not be information that people have been privy to. And as a health communicator, we want to help people learn about those things in a very accessible and easy way. Next slide. Dr. Balbus talks about the threat to our health infrastructure. We have a lot of providers we work with. We have a robust network. Are they all aware of the ways in which climate change is a threat to our healthcare infrastructure? And what is our role in helping them to understand? Next slide. So how do we do that work to communicate and empower? We want to provide opportunities for our associates to learn about climate and environmental issues. We want to educate people about the ways in which the environment and health are connected, and really making it clear that the climate crisis is a health crisis. We want to support and incentivize action among our providers, among our members, among the communities we serve. And we want to work in partnership with municipal leaders and lawmakers to advance healthier environments for healthier people in the communities that we serve. At Blue Cross, about 80% of the municipalities in Massachusetts get some Blue Cross coverage from us, and some of them have robust climate action plans and are really ambitious, and some of them really haven't thought about their emissions or their climate change adaptation at all. So how can we support those varying degrees of climate planning in our municipalities? Next slide. I'm just going to jump through here in the interest of time. Next slide. Next slide. And next slide, sorry. I just want to close with this one quote from John Holdren, who was the climate advisor to President Obama, and said this back in 2007. We basically have three choices: mitigation, as we know that's reducing our emissions; adaptation, like increasing a wall to prevent from sea level rise; and suffering. We're going to do some of each. The question is, what is the mix going to be? The more mitigation we do, the less adaptation will be required and the less suffering there will be. Next slide. I'm happy to talk more about this with any healthcare organizations, any other insurers. I think it's very clear that we have an imperative as health organizations to really act on these issues. You can always contact me via email or on Twitter at Dr. Lindsey Butler.